to a big conference, Living with Cancer, which features many international experts. It's got underway in Trinity College this morning, and our reporter Aisling Reardon is there.
Hi Keelan, things are getting underway here at Trinity's Biomedical Sciences Institute just off Pearse Street. Now over the next 2 days, 25 experts from 5 different countries will share their expertise with over 200 delegates. Now joining me now is John Reynolds, who's Professor of Surgery here at Trinity. John, tell me a bit about the conference.
Well, this is the inaugural Cancer Week Ireland, and it's a partnership between Irish Cancer Society, which hosts at this time of year a conference for its patients and their families, and Trinity, which hosts a cancer conference that's based more on advances in clinical cancer care and cancer research. So the partnership involves the international faculty being involved in both conferences, and clearly the bottom line message is the same, whether it's for the cancer community or for the patients, but obviously it's communicated in a slightly different way through these conferences.
And what is the message?
Well, the message is, obviously, the realistic message is that there's been an awful lot of improvement, and an up to 10–15% improvement in overall survival across cancer in the last 10 years or so, and there's continued progress. But the realism is there's still enormous challenges in terms of how cancer, the sort of challenges that cancer presents to us. And the best way of tackling it is through this type of interdisciplinary working of clinical people, research scientists, and those that support cancer research and cancer development, working in teams, because that's the best model. So bringing medicine and science together and applying that to patients in real time through translational research and clinical trials.
Now the experts are from the US, the UK, Germany, France, Ireland. How is Ireland faring amongst the other countries?
Well, in terms of the available data and outcomes, it's good, and it's right up. The reality in cancer is that Ireland, like every country, is connected through its research community with national and international networks. And it's a small world, and we're all progressing together internationally.
Okay, thank you very much for that, John. So if we head over here in this direction, we're going to meet Dr. Michaela Higgins, and she's Assistant Professor with Harvard Medical School in Boston. You're Irish?
Yes, I am. Delighted to be home.
So you're over there in Massachusetts General Hospital working hands-on. So you've got the practical expertise, you have the clinical. You're there 7 years in breast cancer. Tell me a bit about what you're seeing.
Well, I think the first thing to say is that the quality and the calibre of physicians in Ireland is second to none. We can certainly rub shoulders with the best of them. I've been privileged enough to work in great institutions in the States, including Mass General, and what we have there is the luxury of time. The ratio of consultants to patients is very different in America versus Ireland. For example, in my clinic in Boston, I would see 10 or 12 patients in a morning, and here I'll see between 40 and 50. It's very hard to be productive and to do clinical trials and research in breast cancer if you're simply swamped with that clinical workload. So there are fabulous strides been made abroad and in Ireland, but I think it's quite challenging to do it with the Irish workload.
The good news is you're coming back to us.
I am.
And you can share your expertise.
Absolutely. Looking forward to doing that. Yes, yes.
Brilliant. Now, the advancements in breast cancer care have been huge.
Absolutely. It's a very exciting time. I think some of the things I find most exciting are this era of what's called liquid biopsies. So traditionally, when we're diagnosing breast cancer, or indeed any cancer, we've required a tissue sample, which can be a painful procedure either at the time of surgery or a further procedure for a patient. But over the last few years, some work I and others have done have developed really sensitive blood tests that can pick up fragments of cancer tissue or DNA in the bloodstream and can be used to detect and track cancer. I think it'll really spare patients and be a useful invention.
That's great to hear. Thank you so much, Michaela. Enjoy the conference. Michaela will be speaking later on this morning. Now, if we join Alwyn Ryan from the Irish Cancer Society. Alwyn, it's Cancer Week, so there are many events happening. Tell me what's happening on Friday.
On Friday, the Irish Cancer Society is holding their National Conference for Cancer Survivorship. It's a 2-day meeting on Friday and Saturday in the Aviva Stadium in Dublin. There are about 160,000 cancer survivors in Ireland at this point, and as treatments improve, those numbers are going up. And one of our 4 strategic goals in the society is to improve the lives of those living with cancer. When you get a cancer diagnosis, patients have a number of side effects, both physical and psychological. And really the whole idea of the conference is to support patients and families, those who are supporting them, to get through that time and to come out the other side, ready to integrate and get back to normal life again.
And there'll be lots of people attending the conference. There's a few speakers who are doubling up because obviously it's an inclusive week.
Yes, I mean, we're delighted to be working with Trinity on the 2 conferences. One obviously a very clinical meeting, scientific meeting, and then one for patients. And really to promote the good news about cancer this week. We have crossover speakers, and we have other international speakers and national speakers coming in for the conference.
Excellent. Thank you, Alwyn, and best of luck with the conference. And that's on Friday and Saturday, the 2-day conference. So there you have it. You've heard about lots of advancements in cancer research and treatment. If you want more information on the other events that are happening throughout the week, you can go onto the Irish Cancer Society's website.